Good afternoon, everyone. I'm Dr. Minesh Patel. I'm basically considered pulmonologist and intensivist at SIMS Hospital, Ahmedabad. I welcome you all on the behalf of the SIMS family for this Zoom meeting for this COVID-19 OPD protocols. Before starting the lecture, I will just give you some brief rules about the Zoom meetings. My guy is sitting next to me and he is managing all the invitation of yours. Two rules are there. Your all the participants audio and video will be muted. So I just say just request to you, do not unmute it. So how this lecture goes in around 30 minutes of span is like 15 to 20 minutes I just deliver the lecture, and those who have a question, they can write it in the chat. So he will be just noting down the questions, and after that I will be just answering your questions after my talk is over. So hopefully I think I'm audible, or and people can see my PPT, so anyone can just reply in the chat, so at least we can make sure that you are seeing my PPT and my audio and the video will be clear to you. So anyone can reply. Okay, fine. So now we are just go ahead. So during this pandemic, so whatever we have faced is now how we can manage our OPD patients. So this is just how the talk will go. Slide next. Okay, so overview of this topic is like goes like in the 20 minutes. How we gonna proceed further? First, what is the screening protocol you can develop at your clinic and in any corporate hospital? What is the role of the Arogya Setu app as been told by our Prime Minister Sri Narendra Modi ji? How you can develop the flu corner and how you can utilize the flu corner? And those who are non-flu patients or those who are having without fever or any patient, how you can have a OPD room protocol. Then what are the basic guidelines for the PP, what you can wear in your OPD or what you can wear in your respiratory clinic or in the flu corner. Just I give you the updates about the COVID test also in OPD also, because this is a recent advancement yesterday happened, and regarding also prophylaxis. So, okay. So this is first, now we focus on the screening protocol. So we have developed the guidelines, or we can have developed the protocols in the sense that how we gonna at least having a screening protocol. So first and foremost, what we're gonna do is that any OPD executive or appointment staff telephonically ask about what is the patient's complaints. So if they call the doctors or any OPD staff or the OPD manager, so they ask the question. And once they say that they have a symptoms, they want to visit the doctor, they will strictly tell them we have one patient and one relatives will be allowed. That's a strict visitor policy we are following. We are not allowing any other relatives, whatever the condition it may be. Then we start the level 1 screening at our entry point. Entry point that we have made in SIMS is like we have one new building. In that ground level parking, we have made a level 1 screening on the entry. So any patient or the relative would be screened. They will be screened with the temperature of the patient or the relatives with the infrared temperature gun, and digitalized, that will be in a digitalized form. And if the temperature is less than 99, then we can allow the band, we can apply the band on the wrist that this patient has been screened and he is safe mostly, and he can be allowed in the hospital. So those we can count as a non-suspected. Whatever we do with the suspected people, suppose someone say I have a fever, I have a cough, but I don't have breathing problem and I don't have any travel history. So what we'll do to them that any suspected patient who have a fever more than 99 or any cough, whatever you have, so we ask the patient to go to flu corner, and our OPD staff or executive will give the patient and the relatives the 3-layered mask. So it's a 3-fly mask we give to the patient and relatives both. Okay, so now coming to how we're going to screen that. So you see on the my right hand side, that we have some staff, I see you a photo of that. They have also rate line also, so they cannot jump on the table also. So on the table, you can see that there's a QR code scanner of the Arogya Setu app. Previously, we used to have a form to be filled up, but with this Arogya Setu app development, everyone has to request to, you can just scan the QR code, and whatever the question they are being asked, they can just give a tag number. What is your age? What is your condition? Do you have a past history? Any history of travel? And then they say there's a green signal on the Arogya Setu app. They then will allow the patient to the queuing of the level 1 entry. So on the left hand side, you see that we have made a one page to each and every table. That QR code has to be scanned for the Arogya Setu app. And once you go for any Arogya Setu app, on the left hand side, the first question is on the Arogya Setu app is that, what is your gender, male, female, or other? And the second question will be, what is your age? And then the third question will be that all the CDC common symptoms of the COVID is that, are you having cough, fever, or breathing difficulty? And then comes the, suppose if you say you have a cough, fever, or breathing difficulty, both of you take, they will ask you, are you having any previous disease, like whatever, a heart condition, lung condition, diabetes, and hypertension? Suppose you take the lung condition, then they will ask the further question is that, have each of the following applies to you? Have you traveled in 15 days? See, traveling history internationally now at this in April month, it won't be very much important because we have been in lockdown since last 3 weeks. So this is not as such as important as it was previously. Suppose the second question they will ask that recently interacted or the lived or currently live with someone who has tested positive for the COVID-19. Interacted, lived, or the currently. So all the words matters. And suppose, am I a healthcare? I'm a doctor, I'm a nursing staff, I'm an attender, so that all we need to answer. And suppose you take that I have recently come into contact with a COVID positive patient. So that app is advised you to that you are the high risk patient. You can contact your local authority, or you can just contact the testing authorities of your city or your district, and then you can go to that hospital or the lab. So in Ahmedabad, we have 104 number, or you can go to SVP, or you can go to BJMC Civil Ahmedabad. So this is how this feature of the Arogya Setu app goes. And suppose you are safe, suppose everything, you are less than 60 years of age, you don't have any past history, you don't have fever, cough, they will mark you as a you are the safe. Another new advancement in the Arogya Setu app, you can see the cases on the right hand side that I mentioned you that 650 cases in total across the India. So this is a nice app. At least everyone should download it and use it because the information will shared by is very good. At least you can have authentication because previously we used to have different numbers of case reports and everything. So at least it is very good to have this app. The only negative factor about this app is that the Bluetooth will be on for two minutes. So it consumes your battery and everything. But yeah, it is fine, but it is still active. The Bluetooth will be active in the this once you have downloaded the Arogya Setu app. Okay, and they will trace your location every time. So now we move further. And what I do, suppose the patient has scanned the QR code and the Arogya Setu app tells you that you have a green signal to go. What our staff will do afterwards, they will put the you see on the left side of photo that we ask the patient relatives to stand in a queue with each box is inside it, and then we first ask you to wash their hand, make it dry, and on the right hand side we have our attendant staff. You see that on the table there is a sterilium, then there is a band, safety band, and the infrared gun. So this is how we screen the patient. So suppose we find anything like patient has a fever. So we ask the attender or the executive to send the patient to flu corner. So what we're gonna do, this is a broader image of that thing. So this is a sterilium or even a hand sanitizer. This blue one, you see the mark, that should be marked to be every doctor or the hospital staff. This band things, it's all for the any patient or relatives. So this band is for the screening for the patients and the relatives. And this marker will be applied to our names like what mark. So that will be done to each and every staff of the hospital. So even I have to come here, I have to do every day. And then this is the infrared thermometer, or you can say infrared gun for the temperature measurement. So this is digitalized. This is how we allow the patient to enter at the level 1 entry. Suppose patient has something like patient has some other problem. So we suppose they go to flu corner. So in the flu corner, we have a medical officer and attendant. So in the flu corner, they have a right to examine the patient, and if they feel that this patient requires some testing, so we have given authority that they will do a CBC and chest X-ray on their own, because if we have fever and cough, both are the common criteria, most common criteria to have a COVID symptom, most common symptoms of the COVID. So suppose if it is a positive, so then we have to coordinate with the AMC and then have to go to civil hospital or the SVP. The advancement, the recent updates, I will just deal you afterwards once we are going to finish the lecture. And if it is negative, then we are safe. So once the patient, that is also for the flu corner, and suppose the level 1 screening is properly done, very good, and they are all are negative. So we send the patient to go to any their normal OPD registration desk. In that OPD, they have to sit with the 3 feet apart at least. And we have also in Sings also, we have a primary healthcare officers. They also check the patient's vitals. So even they check that once the primary health checkup done by the medical officer in the OPD area, if it is allowed, then you can see the patient. Any patient, you can see that. So this is how we proceed for the everything, level 1 entry to the level 2 entry. Okay, level 2 entry will be done by the medical officer of the OPD area. So anyone who is having on their, or they have own clinic or the hospital, what they can do to simplify that thing, you can ask your receptionist to sit in front of the gate, at the gate, and then you can allow your any medical officer to train nursing staff or the brother to sit on the second chamber or something. If they say there is SpO2 is low, rate is high, temperature is high, so you ask them to go to other hospital, or once everything comes negative, you can see the patient as a clinician or the physician or the pulmonologist or intensivist. So this is how the protocol that we have developed. Now comes the flu corner. The flu corner person who is sitting in the flu corner, definitely what I told you previously, that every patient who has a symptom, they have a 3-ply mask. So that is a dictum for every patient related both. And the doctor will be wearing all the typical extremely precautionary PPE requirement that they have it. So they also wearing this typical, you can say the N95 mask, the cap, the goggles, the eye shield, typically eye shield or the face shield, they also can wear it, hood or face shield, gloves, and the shoe cover. So they will be typically just same like what you see in the isolation room. They are typically has to wear, and then they have to enter the flu corner till their duty. Okay, so hope you understood regarding the flu corner. Now you come to around this, already told you that all the things will be covered in the flu corner. So what we're going to tell the doctors that suppose they're wearing the N95 mask daily, so we give you the 4 N95 masks, and on the, we write the name and the date. Suppose I have a 4 N95 masks, so for the 4th day, today I want the one new one, second, tomorrow I wear the second new one, third I wear the second new one. So till 4th day we wear the new one, on the 5th day I use the first one. So this is how we gonna at least reduce the contamination of this mask, and that mask to be kept in your personalized bag that is named for you only, and that should be kept inside your locker or inside the with the nursing staff or those who are managing all the N95 mask of yours and the goggles also. So this is how at least we try to reduce the consumption, reduce the cost, and this is also we follow the criteria of the whatever the guidelines has said to us. Now you just make you understand what is the flu. It is a separate room. In that you can see on the right hand side the doctor is sitting, and all the typical covering, the N95 mask, gloves, facial, goggles also they wore it, and typical this white covering that this covers from the top to bottom. So from head to toe it will be covered, and also shoe cover has to be there. So now comes the once all the patient have a negative point, but they have been screened at the level 1, level 2, that all comes with a negative. Then what you can do as a doctor, suppose those I'm talking about those who are internal medicine, those who are pulmonary medicine or intensivists, they will at least I would say wear the N95 mask with the face shield, whichever the method you want to procure, and the face shield will be the ideal one. But those who are not on that category, they can only just have a 3-ply mask. N95 is not mandatory for each and every one. So that is a message I want to convey, that N95 is not an every time necessary. Then you can just typically wear all the gowns, gloves and everything. So this is all for the OPD doctor, those who are seeing the patient after all the screening method. So in the respiratory clinic, I told you that N95 is a must, and the face shield will be the must, and hand rub will be fine. and all the staff has to wear your typical gown, cap, mask, 3-ply mask, not every time N95 mask. Okay, fine. So this is how our OPD or respiratory clinics, I just make you understand that our doctor is sitting with the face shield, with the cap, with the N95. First, they have a 3-ply mask and an N95 mask or a N95 3-ply mask, and then gown, gloves, and the shoe cover. And the patient relative will be sitting and regarding 3 feet distance. So this is where made of boxes. So just to make you just go to the PP, that's the first one is what's the level 1 PP. To make it very simple, you can have a gown, cap, mask, gloves. That is a simple thing, you can have it. If you want to have, really you want to work in respiratory clinic or the really internal medicine guy, then you can wear the N95 mask with all the facial protocol that I already mentioned to you previously. So this is how at least we at least take care of ourselves as a doctor or being a medical professional. Face shield, N95 mask, the gown, the gloves. So this is all we have to be where any patient you see, before that we have to do this stuff. Okay. And the level 2 PP is already mentioned to you, that N95, the same what you practice in respiratory clinic also. So this is how at least for the level 2. The level 3 is for the typical isolation room with the COVID positive wards. So in the COVID positive ward, to make you understand, this is like the same thing what we have seen in the flu corner. Typical, you have a hood, typical from head to toe. This is the N95 with the flying mask. Also, you want to wear N95. There's a facial, there's a goggles, or those who are intensivists or pulmonologists, they can wear the facial till covers here. And then you see it's a gum boot. You want to see that typically the gum boot or the shoe cover has to be there. Okay, this is the level 3 PPE. The recent updates what he have made is just now is that in just 15th April, after deciding after the 14th April statement from the Prime Minister Narendra Modi, they are defining the spot zone. So now what we have done mandatory is that they mostly on the OPD basis and IP basis, they have to have at least Aadhaar card. So at least we can see that what's the area. So suppose the area is from the hotspot zone, that the person coming from that area is having the larger number of cases. So for that kind of cases, even if they are asymptomatic, they will be sent to flu corner. And the flu corner, mostly, not every time, if they have it at least contact or something we have found positive, we can send the COVID test from the OPD basis. So from yesterday, from 15th April onward, we can send the COVID test from the OPD to the 2 labs what we have in Ahmedabad is like that is one is Unipath and one is the Supratat. So these both things has to be considered nowadays, that we just need to make it consideration that as a doctor, as a MD, we can send the report now. So this is how, and we have to fill up the form and make a stamp and sign. We have to follow the protocol of the ICMR, whether this patient fits into the criteria. These changes are just the recent one. We are not generalizing the thing that every asymptomatic patient has to be done COVID positive. That we cannot answer that question right now. But yes, if it is there, we can do it, it's better for the community and first for the patient, better for the community also. Now, what are the recent updates that with the ICMR has done it, that all you know is that first, what are the testing criteria? Suppose you want to send the patient for the COVID test. So what are the criteria that in that you can send the patient for the COVID testing? So all the symptomatic individual who has traveled internationally in the last 2 weeks, all the symptomatic contact of the laboratory confirmed cases, not a suspected, laboratory confirmed cases, all the symptomatic health, any doctor with the fever, cough, that should be screened with for the COVID. All the patient who has a fever, cough and pneumonia, every patient who has pneumonia in this time should be screened for COVID test. The fifth one there is that asymptomatic direct and the high risk contact of the confirmed case should be tested between day 5 and the day 14, not on the day 1. Suppose I am positive, person sitting in contact with me develops or not develops the fever or something, but that patient's context test has to be done from the 5th day to 2 weeks. The 6th criteria, it's not for, it is only for the clusters and the red zone areas. So all the symptomatic with the fever, cough in that area should be done the COVID testing in the hotspot I am saying about. Okay, so this is not completely to the hospital, it is for the hotspot zone. So now what you can do good for the patients for the prophylaxis of the flu OPD, you can just, not everyone is using the prophylaxis in the world. But according to ICMR criteria that we are using this SCQ prophylaxis protocol. So those who are in the flu corner or those who are being exposed to the fever, cough and patient, they'll be given the SCQ prophylaxis. So what's the dose? Generally it's a 400 mg BD, but generally what we get 200 mg is commonly available. So what you're gonna do, the first day we give it 2 doses in morning and 2 doses in the evening after meal. This has a gastritis side effect. So every tablet has to be taken after meal. And on the second day, what we're gonna do is that we gonna second day we give a 200 mg tablet, 2 tablets in the morning hours, in the morning time. And then every weekly they have to repeat this same thing. Suppose Monday I have taken 2 tablets, so next Monday I have to take 2 tablets till 7 weeks. I don't have any answer after 7 weeks what you're gonna do, but this is the guidelines. We never know if till 7 weeks COVID lasting or not, but probably the way it is going on, it will last more than 7 weeks. So I would say around more than 2 months I'm saying out, but yes, this is the same protocol what we follow in swine flu also. Till the last contact of the 10 days, we have to take the Tamiflu. Same thing applies over here. Till 7 weeks, we have to at least take the HCQ, but not beyond that. That is not recommended by any guidelines now. So this is how you at least protect your doctors, nursing staff, and the attendant. For prophylaxis, the treatment is different. You have to use it HCQ and azithromycin for the 5 days. So that's simple. And for that, the treatment part, the HCQ is 200 mg BD for next 200 mg BD for at least first day it is 400 mg BD for 1 day and 200 mg BD for the 4 days, and with the azithromycin. Just to make you aware, that was a mask difference. On the front, the blue one is a 3-fly mask, and the lower one is a 2-fly mask. So you see the difference. The transparency is very transparent. Is a 2-fly mask. The green one is very transparent. So to have a better protection, you require 3-fly mask. So the blue mask is ideal for those who are having fever or cough. That is to be worn by everyone, those who are in the doctors or whatever it is. And we just make sure that the government release that everyone has to wear the mask. It is for that person who is coming out of the home, they can wear the face mask made of anything. Not every time you have to wear the N95 mask. We see many people are coming with the N95 mask, even they don't have a contact history, they don't have a symptoms. So this is not at least advisable, because N95 healthcare profession requires more than the common public. You are right also on your part, you want to be very safer, but there's a very scarcity of N95 mask in the current era. So I would say that 3-fly mask is the best enough. Even also according to CDC guideline also, it is good for the prevention of the infection. So I would say that 3-fly mask is the best, not the N95 for any common human being. So to summarize all the things what I told to you is that strict protocol needs to be followed. You have to implement a strict protocol. CDC guideline must be followed. They have a strict basic criteria that you have to wear gown, that we have to wear the goggles, that we have the face shield, wear the mask and the gloves, and shoe cover if it is required. Modify the protocol according to your branch specialty and your hospital facility. Whatever you have the sources, what is available to you, so you have to modify yourself. You have to modify the protocol on your own with some basic standards. Cost factors needs to be considered definitely because of this area, because everyone requires a mask, everyone using the mask, and everyone knows that its mask cost is very high nowadays, because not suppose it's 10 rupees mask, now coming with 20 rupees mask. So that's the factor needs to be considered. Infectious department has to be very strong. It's a main pillar of your whatever the protocols you have in OPD clinic, or you have a COVID ICU protocol, or you have a respiratory clinic protocol. So that thing has to be there. They are the main pillars of this to guide you for every department the protocol. Restart. See, this is the very contradiction I'm telling about, is that restart your medical OPD with a strict protocol. So strict protocol has to be followed. I'm not saying that some people will say that why to start OPD, why to not start OPD. There's still a confusion, but there are many non-COVID patients are suffering nowadays, and we are seeing nowadays where non-COVID patients are coming back to us. So restart the medical OPD with all the standard precautions, what I have told to you, what CDC has told to you, what AIMS told to you. So suppose you talk about the AIMS protocol, they only say that you just wear 3-fly mask, N95 mask in the respiratory clinic, and then wear gloves. To make it very slim. And those who are cleaning the clinics of yours, they has to wear the typical sterilization technique and with the yellow gloves. And one of the three people only just thinks fever nowadays. So what I want to convey the message is that any fever, we have 100 cause of fever. So it is not that every time the fever is a COVID. So what we are doing, we have the guideline says that fever plus cough, or you have a breathing problem. So that's a criteria you have to strictly follow. So any fever is not a COVID. So that makes sure that we have a lot many cases of SBP nowadays. Also, we have a UTI also. So in that case, if patients are being referred here and there, and they typically have a very chaotic mind afterwards, what to be done, doctor. So I would say not only fever, you just focus on other symptoms also. The fever has to be there, but there are a lot many causes of fever. Even I cannot enumerate the numbers of the fever. But thing is that you have to just see the clinical. So clinical mind has to be applied. So that's the main message I want to convey. And the lastly, I want to just, this is my last slide. I'm coming up to next slide. This is just what else you can do to fight with this COVID pandemic. The main thing is that prevention is a treatment. There are no any other disease that we have that we just mainly focus on the prevention. Suppose you talk about swine flu, we have a treatment. But for the COVID, we don't have a confirmed treatment. The confirmed treatment I talked to you about HCQ and azithromycin, that has to be decided by ICMR, is only for the severe cases. It is not for the mild or with the mild to moderate pneumonia cases also. So hopefully I can say the people still maintain the social distancing and at least maintain the hand hygiene, wear the mask, and this is the treatment for the disease. There are very less disease in the whole world that we have to use the preventive treatment for the treatment of the disease. And after doing that, after 1 or 2 months, we shine our Indian flag, then we see that how the India has behaved a very in a standardized manner, and we make this flag proud, and we as an Indian make ourselves proud that we have conquered this pandemic. So by concluding this my remark, I just conclude my talk over here. So I thank you all of you from this all over the part of the Ahmedabad, India, those who are joined from the outside also. I thank you everyone to spare your time around 30 minutes with me and with the SIMS Hospital. We always we are happy to thankful to you. So thank you. Bye.